Rubella is a member of the alpha virus group, but when we talked about the arboviruses, which most alpha viruses belong to the arboviruses, I mentioned briefly rubella, which is not one of the arboviruses because it is not transmitted by an arthropod. Instead, this is a respiratory virus. It does not cause really any noticeable CPE. Like the other alpha viruses, it is a single-stranded RNA virus, and it is a positive sense strand RNA virus. Rubella can also sometimes be called German measles. Some of the symptoms in children are going to be similar. You'll have that kind of full body rash. The reason that we are more concerned about rubella is because when a mother is infected during pregnancy, especially during early pregnancy, that can have very significant effects on fetal development or even the ability for the pregnancy to continue. So, rubella, respiratory virus, it can go into various organs, lymph nodes, macrophage, liver, spleen. If you have a primary viremia that then develops into a secondary viremia, in a pregnant patient, you can have congenital infection of the fetus. Again, when we're talking about an infection in literally anyone else other than a pregnant woman, it's not that big of a deal. I mean, here we see kind of the course of infection, rash, kind of like swollen lymph nodes, fever. It really isn't that big of a deal. Now, the problem, again, that we have in pregnancy, the major issue. So rubella is, as far as we know, a human-only virus. And one of the challenges with a lot of infections, but with rubella as well, is that infection can be transmitted prior to the onset of symptoms. So a patient may not know they have rubella, they're not quarantining or isolating or anything like that, and so they can then spread the infection. If you or a loved one decides to become pregnant, one of the things that you may be tested for is the presence of antibodies against rubella. Most patients should have antibodies against rubella because most patients should have been vaccinated against it. We've talked about the MMR vaccine before, measles, mumps, and the R is rubella. Now, unfortunately, as sometimes can happen, even when patients are fully vaccinated, they may not have maybe mounted a great immune response to the vaccine. Perhaps the immunity has waned. And so it's really important to test either if you're a physician and a patient is planning to become pregnant or is in very early pregnancy to test for those anti-rubella antibodies. For example, I am 100% fully vaccinated against pretty much everything I can think of except for, some of the tropical infections because I don't travel much. But I did not have any antibodies to rubella during pregnancy, so I had to get an MMR booster. I know I have antibodies to measles because I was tested when I worked for the Army, but for whatever reason, my immunity to rubella had waned. And so that's entirely possible. It's a quick shot at the CVS in Target and you're good to go. In a non-pregnant individual, what you would generally see is a 2 to 3 week incubation period, and then a very brief period, 3 days or so, of a rash and swollen glands. In an adult, the infection can be more severe than in a child, generally because there is a more robust immune response. But again, we're not really talking about fatal infections even in an adult. So what we're worried about, again, is in our neonates. So this is some data from the mid-1960s when there was a major outbreak of rubella in the US. You can see there were 12.5 million people who got rubella. Just over 10% developed some arthritis or joint pain. A couple thousand individuals developed encephalitis. But what numbers we're looking at here under deaths, there were 2160 deaths. The majority of those were neonates. Only 60 out of 12.5 million patients, infant and older, died of rubella. Instead, we're looking at those excess fetal deaths, the neonatal deaths. We also want to look at what we're looking at here. This is a really ugly term. It's the term used in your textbook, and it's the term that was used at the time. Excess fetal wastage. That basically means miscarriage. So these were neonates that died. This could also be like late-term stillbirths. These are miscarriages. We also look down here, about 5,000 therapeutic abortions. So these are patients who discovered that their children were basically not going to be viable after birth and decided to have an abortion instead of deliver a child that was going to die anyway. And again, as a medical professional, your feelings on that don't really matter. What's really important is to provide the medical care that the patient needs and that the patient wants. So that's something really important to think about. The other numbers we can look at here are for congenital rubella syndrome. So these are children who were born to women who got infected during pregnancy. You see that there were just over 8,000 children who were born deaf, almost 3,600 children who were born deaf and blind, nearly 1,800 who had significant mental defects that basically require lifelong care, and 6,500 that had other symptoms of congenital rubella. So nearly 20,000 infants who were born with congenital rubella syndrome. So it's not a minor thing. That's why we have a vaccine. So we want to make sure that everybody gets the rubella vaccine. A woman infected with rubella during the first 3 months of pregnancy has a 90% chance of giving birth to a baby with congenital rubella syndrome, or her baby may not survive. So those are not great odds if you are unvaccinated, don't have antibodies, and get the infection during pregnancy. Globally, there are more than 100,000 infants born each year with some form of congenital rubella syndrome, which can include blindness, deafness, both heart disease and other birth defects. And it's estimated that basically half of the children in the world don't have access to this vaccine. It's actually very cheap, $2 to vaccinate a child against measles and rubella in low-income countries. Thanks to vaccines, the Americas were declared rubella-free in 2015. But again, worldwide, we still see rubella. If isolation is necessary, you can get the virus from the urine. What you're going to be looking for is the presence of anti-rubella IgM. Remember, IgM is one of the first antibodies produced during infection. So that would indicate an active infection versus memory. Or you can do the reverse transcription PCR to look for the viral RNA. There is no treatment available, but there is a live attenuated vaccine. And so what we see are the rubella cases in the US and how they really plummeted after the introduction of the vaccine, including the numbers of congenital rubella syndrome.